A candid discussion on vaccinations and the African American community here in Kern County. A 17 News Town Hall.
Good evening and thanks for joining us for a special edition of 17 News. I'm Moses Small, and tonight we're talking about COVID-19 in communities of color. So the CDC death rates from the disease out of anyone in the country passing away at nearly triple the rate of white Americans. And Hispanic Americans, as you can see over here, are dying at about the same rate. And right behind these groups are Native Americans and then Asian Americans passing away at nearly the same rate as white Americans. And in addition to that, health experts around the world say vaccines will be the key to ending the pandemic. Nearly 90% of people need to take it, but not everyone wants one. The Pew Research Center asked over 12,000 Americans whether they want to take the shot. About 60% say they want it, but some groups were more willing than others. Less than half of Black Americans said they wanted a vaccine, and that inspired this panel discussion because the whole community needs to work together to wipe out the virus. That brings us to our panelists today, all African Americans in our community with a range of experiences with the disease. And everyone, thank you guys so much for joining us today. And so I want to go off. We can start off with introductions. And Marie, I'm wondering if you'd like to introduce yourself first.
Hi, my name is Marie Ruffin. I am the clinical director of outpatient services for Kern Medical. My background is emergency room nursing and been a nurse over 28 years.
28 years. And
Yeah.
Dr. Thompson.
Hi, my name is Dr. Thompson. I'm a radiation oncologist at the AIS Cancer Center through Adventist Health.
And Dr. Amobi.
Hello, my name is Dr. Amobi. I'm a third-year resident in emergency medicine here in Bakersfield at Kern Medical.
Amazing. And Dr. Claiborne. Dr. Claiborne, you hear us here? Okay, we appear to be having a little bit of a technical difficulty on his end, but let's dive in. And Brittany Edwards, if you could introduce yourself here.
Hi, Dr. Ronnie Claiborne. I've been in practice.
Yes, sir. So I think the internet may be a little bit delayed here. And Brittany, love to have you introduce yourself.
Hi, I'm Brittany Edwards. I am a Bakersfield native. I am here as a community member.
And you're here as a community member, and you shared your story with me over the phone a few days ago, and it really moved me, and it really shed some light on what exactly this is doing to our communities of color. So I'm wondering if you could share a little bit about this experience that your family has gone through.
So I am here to share my own personal experience with COVID-19. I'll take it back, kind of when it all started a little bit before Thanksgiving. Just like any other family, we were getting ready for Thanksgiving, preparing last minute dishes. My aunt actually called and advised us that we weren't having Thanksgiving at our house. And I was initially, I'm like, what do you mean we're not having it at our house? Like, yes, we are. But she then proceeded to tell me that our family had been plagued with the virus. Fast forward about a week later, my aunt calls and tells the family that she has had to take my grandmother to the hospital from the difficulties of the virus that she was having. My grandma was in the hospital for approximately 2 weeks. Every day was a battle. The real MVP is actually my aunt. She was there. All recognition and all commitment goes to her, from the late nights to the sleepless nights to just being there. Every night was different for her. Every phone call, every doctor's report, every hard conversation, every difficult conversation, she was there. My aunt would tell us that my grandma had her days mixed up, where she thought, the night was day and day was night. So sometimes she would crawl in the middle of the night, just because she was alone in the hospital. She would call my aunt, and my aunt would pop up, like she was already awake, just to make sure, my grandma knew that she wasn't alone. She was available for her. Sometimes, my grandma didn't have the energy to talk. So, my aunt would literally research current event, specifically politics, because my grandma liked to discuss politics. So she would just talk to her, while she was in the hospital.
And she had an extremely difficult experience.
Sorry.
And I am sorry, we do have just a moment here left in this segment, so I'd love to pick this right back up. And of course, African Americans do have a lot of historical trauma, making many suspicious of medicine. And when we come back, we're going to hear more from our panelists about COVID-19 and how it impacts African American communities. So we'll see you right back here after the break. And welcome back. We are here with our discussion about COVID-19 in Black communities. And first, we'd like to take a look at some of these numbers, because the CDC reports that African Americans are dying from COVID-19 at nearly 3 times the rate of white Americans. And what comes along with that too is unique health challenges facing this community, and that is why we're here in the panel today. And we are back with all of our panelists, and we want to continue off with Brittany Edwards, who's mentioning the story of her grandmother's experience with COVID. So I'd love if you could pick right back up.
Yeah, of course. So, kind of where I left off. So, like I said, my grandma had, her days mixed up. Sometimes she didn't know it was night and day. My aunt, was there to be with her throughout any time of the night that she needed. Like I said, sometimes she didn't have the energy to talk. So my aunt would actually research current events so she could tell her about what's going on. My grandma really didn't have the energy to talk back, but she would just listen. So sleepless nights, good days, bad days, she was there. Fast forward to December 20th, we got our daily update. My grandma she had a good day. Things were looking good. So we were excited about that. About 6 p.m. that evening is when, we got the call and stating that my grandma didn't make it.
And it's incredibly difficult too, understanding the fact that you mentioned she'd felt alone in the hospital, and it's really such a mind-bendingly emotional experience you guys have gone through. And so I really appreciate your willingness to share that. And Dr. Omobi, you understand from treating COVID patients that there are certain difficulties, and African Americans in particular have a lot of historical trauma associated with medicine. So I'm wondering if you've ever encountered that in your career.
Yeah, it's something that we definitely encounter on a regular basis. The distrust that the African American community has historically had with medicine represents itself in many of the comorbidities that we suffer from as a community that predispose us to worse outcomes with the COVID-19 virus. Diseases such as heart disease, hypertension, diabetes, obesity have been plaguing the community for decades, and it's always been difficult to manage as it is in the emergency department when they come in, either because we have more difficulties keeping up with our physicians, more difficulties accessing proper treatment, medications. We come in sicker just kind of at baseline. And when you add something like COVID-19 that's been devastating even healthy young individuals, it's been really doing a lot of damage to that community.
And what really strikes me here is how quickly it can do damage. And I think that's an excellent point to bring up as well, is that not only are African American communities catching the virus a lot, but when you have these comorbidities, that just skyrockets all of these medical complications you're going to have. And I was reading up a bit of numbers there, and I understand that that affects about 45% of people in Kern County. And those numbers appear to be even higher in African American communities, as you're pointing out here.
Mm-hmm. Mm-hmm. Yeah, exactly. And so in addition to that, when we have a lesser likelihood of seeking care early, coming in to get tested, I think is where we see the greatest deficit. So individuals that might still be working because they're frontline workers at the hospital in different service industries or transportation, might be sick for a while without knowing or testing and spread it to their family members who are unfortunately also predisposed to more serious infection.
Of course, and
Some
testing
might get
is
sick at
certainly,
home, but they have a higher likelihood of spreading it to more members of their family and their community.
and that's another other factor that is a cultural factor as well, is when you have these multi-generational homes, it is so much easier to spread it to vulnerable members of your family. And that is our time for this segment. And when we come back, we have more on COVID-19 in Black communities, and we'll hear from our panelists, shifting our focus to vaccines after the break. And welcome back to a special town hall edition of 17 News. We are picking up our discussion about coronavirus in African American communities, and we are back with all our panelists, as you can see behind here, Dr. Ronnie Claiborne, Dr. Martha Thompson, registered nurse Marie Ruffin, Dr. Ike Amobi, and our community member joining us, Brittany Edwards. And Marie, I have a question for you, and I'd love if Dr. Thompson, you could chime in afterwards. The vaccines have been the center of a wave of conspiracy theories and misinformation that impacts these communities of color especially hard because we have this historical trauma from decades of abusive practices such as the Tuskegee experiment. So I'm wondering if either of you have ever heard conspiracy theories about vaccines come up from some of your patients.
Yes, we have had several different dispelled myths about the vaccine, from am I getting injected with a live virus? If this, am I going to get the whole full COVID symptoms? Will I be able to have children? Will it mess with my reproductive system? Will I end up having Bell's palsy, twitching? So many different myths that as we are starting to vaccinate more of our African American community, they're concerned about the myth. They're concerned about the different things that they're hearing and they're seeing on social media. I know that one of the big things that that was really on the social media that I saw on the TikTok is about how after you get the shot, you start doing some twitching and, you know, and then they made memes about it. And so what we are trying to do is get that information out as we vaccinate. Those myths they're just myths. They're dispelled and they're not accurate. And of course, as you mentioned, there is such mistrust that now, you know, things have changed for us as far as we can give before anything could happen, we can give informed consent. You have governing boards that are able to make sure that before any research or during research that they are making sure that it is protecting the community, the people. So that's things that are being able to protect us with mistrust. So there are a lot of different myths that we're really trying to get out into the community. You're not injected with a live virus. You're not going to get Bell's palsy. There are chances, of course, with any vaccine that you can have a reaction or allergic reaction, but that's.
And of course, it is always a side effect of perhaps any medicine that there is a possibility of having a side effect. And Dr. Thompson, in your work as an oncologist, that brings you in very, very close proximity to a lot of discussions about mRNA and DNA, especially as it relates with vaccines. So I'm wondering if you could fill us in on how exactly an mRNA works, and addressing one of the best conspiracy theories I've seen on Twitter is going to scramble your DNA and turn you into something else.
Right. And so first and foremost, the vaccine does not interact with your DNA. An example I like to use is if you think of your cells as a chicken egg, right? You break it into a bowl, there's egg white, and then there's a separate yellow yolk that's completely contained and separate within the egg, correct? There's the nucleus of the cell where all of your DNA is held, is just like that yolk. It's completely separate, it's protected, and the mRNA vaccine never gets anywhere near it. So there's no genetic implications. The mRNA vaccine does not affect your DNA or genes in any way. The M in mRNA actually stands for message, and that's what it is. The mRNA is a message that goes into your cell, into the egg white part of your cell, if you will. And
it
actually,
seems so also, and Dr. Thompson, so my apologies, we are reaching the end of our segment here. Let's pick right back up on that wonderful explanation of the messenger RNA. And so we will be right back with our panel of African Americans speaking about COVID in our communities, and we're going to pick right back up with Dr. Thompson's discussion of mRNA. Don't go away. And we're back with our discussion of vaccines in the African American community, and Dr. Marcher Thompson, you were just giving us an explanation of mRNA.
Yes, so M in mRNA stands for messenger, and that's exactly what it is. It's a message that teaches your cells how to make just one small piece, called the spike protein, one small piece of the COVID virus. So it doesn't create the whole virus. You cannot get an infection of COVID-19 from the vaccine, but it teaches your cells how to make this one little piece so that it can recognize it, and your immune system can create a response in the event that it actually sees the virus in the future. So that's also why it's important that the current vaccines available, it's a series of 2 injections. So they're exactly the same, but the first one introduces this information to your body for the first time. And the second one really amplifies that response so that you can have a really strong defense against the virus if you were ever to contract it.
Of course, and that is a wonderful explanation of the way it gives your body some protection. And it doesn't happen all at once, and that is a great explanation of why it is 2 separate doses. And Dr. Claiborne, we are so happy to see you once again. And but earlier, we were discussing some of the historical traumas in African American communities. I apologize, we have very little time to work with here, but I'm wondering if you could kind of quickly explain if you've seen that historical trauma in some of your African American patients.
Yeah, it's definitely led to a apprehension about getting certainly a vaccine. You mentioned very well the Tuskegee Institute is well documented over 30, 40 years. And I deal with patients daily, even 2 or 3 today, want reaffirming this, that it's not some ploy, that it's important for them to know. One thing I'd like to add, that getting this messenger RNA not give you, and I would like to, and I really stress that with patients, it does not give you disease. It's just an mRNA for part of the spike protein, not virulent. It doesn't cause disease.
I see. And of course, and I'll bounce back to Dr. Thompson here, and you were addressing some of those other misconceptions about the vaccine. And I believe a little while ago we spoke about some people's belief that you could be implanted with a microchip or anything of that nature. And so I'm wondering if you'd be able to explain why that isn't exactly the case.
Right. No, that's not the case at all. The vaccine is made up of the mRNA, right, and a vehicle around it so that it can go into the cell in the first place. And what's really great is that the cell can actually destroy and get rid of the mRNA after the message has been delivered. So there's really nothing that stays with you other than this information that how to protect yourself against the COVID virus.
And so it sounds like it's essentially giving your body a game plan to work with.
Exactly. It delivers the message, your body gets the message, and it's prepared. You know, it's ready in the future if it's ever needed.
Absolutely. We have just about 30 seconds here. And Dr. Claiborne, I'm wondering if you could share some of the experiences you've had treating coronavirus patients. I'm wondering if you could describe what exactly they look like when you're able to treat them.
Patients generally come in, they have the classic symptoms of chills, body aches, and we want to know whether they've been exposed to anything else, and certainly we want to get them tested. We've had some very severe outcomes that I've seen. I've had in the care unit, had SAD. It's been very detrimental. He's not able to visit them. So I want to really encourage our community to please get vaccinated, even if you have it, and prevent this. This is the only way we're going to get back to a new normal or some semblance of that.
And it seems almost so far away because it has been so long since we've reached that normal, but the world's top doctors say that vaccines will give us that pathway. So we're back with more after the break. COVID-19 is changing the way we live, and the virus is taking the lives of people of color faster than any other groups in the country. But there is hope, and doctors say vaccines will save hundreds of thousands of lives. So today you heard from Black physicians and community members who want the African American community to take this virus seriously. And I want to give a huge thank you for all of these panelists for all of their hard work today and leading up to this and providing this valuable insight for our community. And you guys are truly helping to keep this community healthy and save lives. So I want to give a big thank you to Dr. Thompson, to Dr. Claiborne, to Dr. Moby. I'd like to give a big thank you to Brittany and Marie as well. Thank you very much for joining us for this special edition of 17 News. NBC Nightly News is next. We'll see you back here at 11.
A candid discussion on vaccinations and the African American community here in Kern County. A 17 News Town Hall.